Hey guys, Dr. Michael Derry here today. So I treat spinal stenosis and people after spinal stenosis surgery often. And when I look at these clients and I'm working with them and we're trying to improve things such as pain and strength, one of the questions that I get is, will their leg strength come back after they have surgery? And so that question is a very good question. And I think there's two things that we need to look at before we answer that question is the type of spinal stenosis and the levels involved. And the levels involved are important because that's where you can expect the weakness. And then if you have a conservative approach or a more aggressive approach, so non-surgery versus surgery, and then the timeline you can expect for that strength to come back. And so to have a better answer for that, we need to look at those things first. And so hang with me, we're gonna go over those three components and really talk about, will that leg strength come back to make your life a little bit easier? Let's get after it. So if you worked with a physical therapist, or maybe when you consulted your doctor, they're gonna have you do a couple things. And so if it's more upper lumbar spine, you're really gonna have a little bit more weakness around the hips. And so that's much less common. I rarely see that. What I see is more lower lumbar spine, L4, L5, and L5, S1. And so if you're expecting more L4, L5 involvement, and it could be one side or both, that's gonna be difficult for you to raise your toes. And so I'm gonna stand here, my heels are gonna stay on the ground, and I'm gonna try to raise my toes off the ground. Now, and I don't have any shoes on, feel free to stand next to something sturdy if you need to gather your balance. But what you'll notice is that either one side won't be able to lift up or it'll be really weak, or that you'll be able to not do both sides, or you may notice that your big toe isn't able to lift up as well. And so that's fair game. I've seen that so many times. And the biggest thing that people tell me is when they have those areas of weakness is that they catch their foot on a lot of things. And so they go to walk and they notice that they're tripping, or if it's more exaggerated, they have foot drop. So that's more of the lower lumbar spine, L4, L5 area that we can see. And there can be some crossover too. But what I mean is that like you just have difficulties lifting your toes or your heel or the top part of your foot, or that you catch your toe on a lot of things. The other level that I see very often is L5, S1. And so what this is that, both of those people, the L4, L5 and L5, S1 can have pain down their leg that can go into their calf, into their foot when they're walking. But the L4, L5, typically has difficulty lifting up, where the L5, S1 has difficulty going up on their heels. And so, I'll say, okay, Mrs. Jones, I want you to stand there. I want you to try to go up on your heels, and we're gonna try to do that 20 times. And what you'll notice is that either they won't be able to do it that many times, or if I have them do it on one foot, they'll be able to do it on one side, maybe a good amount of reps, and then on the other side, they won't be able to do it at all. It'll be very hard and they may not even lift off the ground. And this one's really interesting is that people oftentimes don't even know that they have that until I test it. And when you do a heel raise, you have to do it more than once. You have to tax that nerve. It's the same thing in that why you can't walk for a long period of time is because that nerve needs to have a little bit of an ischemic event, or we need to work that nerve enough to notice those differences. And so 10 to 20 is that benchmark for me. And I'm gonna have them do that. And let's say they do 1 on one side, but they're able to get 8 on the other. And while they may be weak, that's okay. You'll notice that very big difference side to side. And so that's more L5, S1. So when we do the clinical exam, we want to figure out, okay, do you have leg weakness? You report that you may have leg weakness or may not, but we always check that because that tells us like the level of involvement or the nerve and how involved it is. And so we do that heel raise or heel toe raise testing so we can kind of see where you're at. And any clinician that you're going to do or work with, they're going to ask you those questions and have you do those things to help figure out what nerve is involved. And that kind of helps me with the decision making long term as well. If they're able to do, let's say, 15 on one side and 20 on another, that's very mild. Where if they're able to do 20 on one side and only 1 on the other, that's more severe. And so the question is like, do you have surgery, or should you have surgery? Or if you did have surgery, how long will it take you to get that strength back? And we're gonna talk about that in just a second, but that's a good way to figure out what levels are involved. Okay, so we just talked about what it looks like and what level that you may have weakness. So L4, L5 versus L5, S1, which are the most common areas for lumbar spinal stenosis. And it could be one-sided or it could be both. And so now we're going to talk about surgical versus conservative. And so conservative is more physical therapy. So you're not having injections or surgery. And surgical approach is like the roto-root approach, where they go through and they try to clear the space around the nerve. It is not as scary as it sounds. It's a very tiny incision. People recover very quickly from it. And as a physical therapist, people would think I'm purely conservative. And I don't think that's the case. I think there are some people who respond well to a conservative approach and people who respond well to a surgical approach. And it's just my role to make sure that you're making a decision that's in the best interest of your health and your body, which may be more surgical or may be more conservative. But it's important to look at the severity of the nerve compromise as well. And so if you're looking at, will that leg weakness come back? Well, in the more conservative approach, you know, you have a little bit of nerve compression, and you may notice that that foot gets weak when you walk for a long period of time, but then other times it may not feel weak. And so for those folks, you know, a more conservative approach is fine, and it could ebb and flow all the time. And so you may notice this more weak or stronger, just depending on the day and what you do. Stenosis is a functional diagnosis in that it usually gets worse when we're doing something. And the classic hallmark thing is walking. So let's say, for example, when you walk for a long period of time, you're walking along, you'll notice that you start to have leg pain and your foot may feel weak or may not feel weak. And that's completely normal. Let's say that you're just sitting here and you have leg pain and you may notice significant leg weakness or foot weakness that is not as normal. And so those are two different types of people. And so when people ask me, will my leg weakness come back? Well, or leg weakness get better? We need to figure out, one, how severe is it? And so oftentimes the medical realm may have you do nerve conduction testing, which I have noticed that functionally it may not make a difference. But my biggest thing is, are you safe? And so if you're having foot drop and you can't walk without tripping, well, then that's not safe. So we need to get that addressed. And let's say other people, they have foot weakness, but it's very, very mild. They barely even notice it. And we only notice it when we do our testing, such as the heel raises or the toe raises. Well, then you may not even want to consider surgery because it's not that big of a deal. It doesn't really bother you. And so those are two different types of scenarios. But the take-home message here is that if you're going to have surgery, it needs to be for a reason. And that reason should be significant. And so significant pain or significant leg weakness, which are the two biggest things when you have lumbar spinal stenosis. And so if both of your feet are getting numb when you walk and are significantly weak, then I would say, hey, Mrs. Jones, like that surgery may be appropriate for you. If you're having mild amount of leg pain, back pain when you walk, immediately gets better when you sit down, but you haven't tried physical therapy or other conservative measures, then I would try that first. No one wants to go and have surgery if they don't need it. Lumbar spinal stenosis, like I've talked about in the past videos, is a space issue. Space, movement, and blood flow are what nerves need to heal. And you can do all of those things with a conservative approach. And so in the grand scheme of things, will your leg weakness come back? It absolutely can get better with conservative and surgical approaches. If you have surgery, don't expect that leg weakness to come back immediately. And if you have conservative treatment, the same is true. Don't expect that leg weakness to come back, but we do work on it. And it may not be 100% like it was, but it will be safer and more efficient, which will make you more functional, in which you may not even notice that you have it anymore. And so I wouldn't necessarily think about, is it ever going to come back? But is it ever going to come back in a way that makes you safe and that you don't notice it? I would shoot for that. And so will leg weakness ever get better? Yes, it will get better depending on what you do and where it's at and the severity of it. But it can get better with a conservative approach and a surgical approach. And so both of those things can absolutely make leg weakness get better, and that strength can come back. But my biggest take home thing is I want to tell you is that just team up with a conservative provider at first, because you can manage it very well conservatively, but it does take time and effort. And so you can do things to help improve the space in your back and the nerve discomfort, and how those nerves react to how when you walk or stand up or reach up, or those things that can be that can typically bother people when they have spinal stenosis. And so all of those things can get better. They just do take work. And even if you go with the surgical approach, it does take work after surgery as well to help retrain those nerves in your body to do the things that you want to do. So as always, guys, stay healthy, keep moving, and take care of yourself. And feel free to leave any comments in the description. But the take-home message is that leg weakness can get better with spinal stenosis and after surgery.